to this webinar. I'm sure there are mostly physiology faculty and may also be faculty from other departments, I don't know, from various colleges. And I believe there may be a few students of physiology, students, medical students also. So welcome everybody, and once it starts, please go through it. We'll take all questions in the end. Thank you very much.
Thank you, Dr. Das. So Das, sir, you can just carry on with it. I'm just giving you the rights to present. I request you to please present your slides.
My slides are visible, I suppose.
Sure, sir. They are.
Okay. So that's the topic, Competence and Education 3.0. And I actually had planned to do a similar presentation in another institution, but unfortunately that didn't work out. And this was very fortunate that Walter Kluwer approached me and asked me whether I would be able to do something. And with the topic close to my heart, I chose this. So just to take you through the outline of what we're going to talk about. The first part, now the topic is Competence and Education 3.0, but I like to approach it the other way around. Because when we are talking about Education 3.0, we will have to go back to Education 1.0, which would mean talking about the history of education. So take you down the ages from when education was actually wisdom to today's artificial intelligence, and then stress a little more on Education 3.0 and 4.0, which is the new normal. I really wanted to use this new normal in the title, but I suppose the title became too long because we all are very familiar with the new normal nowadays. And then, of course, we want to talk about the last part, which is competency-based medical education, about what it is for everybody concerned, for teachers, for students, and for others. So let us move on to find out how medical education has evolved over the ages. Starting with the ancient days. I will mostly be talking about the Indian scenario, but I will give a few references of others also. And this is not a comprehensive history of education. To take you through as to how education has evolved and therefore a better understanding of what is today's world. So we talk about the Guru and the Shishya and the Gurukul, and I think all of you are aware of this sort of a scenario where there was this wise man sitting maybe under a tree or anywhere, and there was one student, one Shishya, sometimes a few more, that was also possible. And what happened in these? Now, we are going to look at each of these with what were the good things and what were the not so good or the plus minus things. In case of the Gurukul system, I don't think there were any bad things. So we will talk about the plus minus. Yes, because the numbers were less, every student got personal attention. That was a good thing about it. There was unlimited time. The Guru could teach anytime. The Guru could actually wake up and say, I just had a dream and I feel this is what it means. Or can say, I could not sleep and I was thinking of this and what do you think about this thought? So time was never a factor. It was not the, I go to college at 8 o'clock, I come back at 4 o'clock type of situation. And obviously, if it's under a tree, it can be anywhere. During a morning walk, during food, education was anytime, anywhere. The things which were not that nice was that it was less organized. There was no laid down rules as to this is what education should be. The content was limited to the Guru. If the Guru did not know about certain things, like we are concerned about medicine, Now, if it was a guru who did not know much about the medicinal plants and the surgical techniques of those days, then the guru would not be able to give that uh, information, or maybe just limited to a few things. And unfortunately, it was a little elitist in the sense that only the better off, or the ones a little higher in society, could get that education, and often the guru chose who to take and who not to take. There are, of course, many exceptions to this, but this was a general rule. In fact, in China, there were schools in those days, schools which were run by the government, were meant for the elite class. They spoke about, arts and religion and literature and etc. They were all in the cities, the so-called cities. Whereas schools which were run privately were in the rural areas and were meant for the agricultural class, so to say. So that was a very atypical thing compared to today's scenario. So this is what we call education 1.0, the beginning. Of course, the beginning could have happened long time back, but in general, it was one to one or one to a handful. Whatever the guru knew or thought, whether it was in the right direction, wrong direction, did not matter. Whatever the guru knew, and most often these were wise men, so to say, and sometimes they were skilled men, the guru gave it to the student, and the student accepted it quite willingly. Things that were taught, apart from skills and all that, were mostly philosophy, religion, ancient science, math, literature, and so on. Unfortunately, as I mentioned before, there was not much scope for the lower classes who were meant to take part in labor and agriculture and things like that to attend these sort of sessions, because anyway, the numbers taken by each guru was less. Most often non-commercial. That was a very good thing about it, because the guru, except for that so-called guru dakshina, a little bit of something, would not accept fees as such. And more importantly, these little gurukuls later developed into school-like structures and universities, which did quite well, and they were quite famous. So that's about, very briefly, about the very past. And then we move on. We move on to the Middle Ages, right up to the 1970s. And this sort of education developed in monasteries in Europe, the first organized sector, primarily because they had to train priests. The education was a little broader, but was still, religion based. And the numbers became greater. Instead of just one to one or one to a few, there were a larger number who could be taught. But the education was authoritarian. Whatever the teacher says is true. The students were passive receptors. Whatever is told to them, they have to quietly take. There's no questioning. And of course, even till the 1970s, when a little bit of technology here, there would have come, technology was banned. I'm sure all of you would be familiar with this sort of scenario. This is actually a picture of I think, an Australian school where, for the first time, television was brought into the classroom. And this, of course, is much more familiar, where the teacher is turned back towards the board and writing. You can see that some are concentrating, some are actually smiling and joking, whatever. This is what we have termed as education 2.0, and sometimes it's called pedagogy. A pedagogy literally means the way children are taught. The way children are taught is unidirectional dissemination of knowledge. Teacher tells, the child just quietly receives. And this is what the teacher probably says. I'll deliver content at my pace and in my way, and you will learn if you can. This is probably what the teacher is saying. It was still driven by religion in the earlier days. Later, it became a little more different. The society drove this type of religion. And it was a 3 R's taught with the 3 R's method. Now, please allow me some orthographic license. Little phonetics on the first letter only. Now, what does this first 3 R's mean? The first 3 R's are reading, writing, and arithmetic. It's meant to be reading, writing, and arithmetic, but I think that's the way we pronounce it. So, phonetics wise, it's fine. And the second 3 R's was receive, respond, and regurgitate. The students received the facts, the knowledge, whatever. They responded by taking down notes or just memorizing it, maybe a little practice, and then comes an exam where they just regurgitate. That was the process of education. And it was one size fits all. You may be a brilliant student who likes to do some research, likes to think, or you may be somebody who cannot cope up with that much of progress. It doesn't matter. What the teacher says, the way the teacher was taught, that is what the teacher is going to give back to you. So that was a one size fits all system where there was no individualization. And the approach was exam based. I think based approach. We prepare according to the exam. We read according to the exam. So that was the exam based approach of learning. And of course, unlike the Gurukul, where it could be done anywhere, this was now confined to brick walls, to classrooms. So that was education 2.0. But then towards the end, it started moving around the 70s from education 2.0 little forward. And this is the scenario. Now you see that it's a little different from what it was before. The reason is we started realizing that it's not teaching children, it is teaching adults. The schools and colleges were involved still, but now homes also started getting involved. The teaching and the learning becomes more student centered. What does the student need? What does the student want? Instead of being a passive receptacle for knowledge, the students started communicating along with the teacher, along with each other. Students started contributing to their lessons and they started collaborating among each other. And technology started coming in. Yes, we know that till today there are situations where we say no mobile phones in the classroom, etc. But technological invasion had started. It was called an invasion, remember. It was not always an acceptable thing. It was an invasion, but it used to come in. Not so good a part about it was that there was still emphasis on the hours of teaching, not the hours of learning. There was, of course, a technology gap where the students knew much more about technology than the teachers, and therefore a mobile phone under the table was often not detected. If the mobile phones had come, that is much later, and the learning was oriented towards a result or a degree. So those were the not so good things. Let's take a look at the other features of this. Now, this is what we call 2.0 moving towards 3.0, not yet sort of reached 3.0. And this is andragogy. The way adults learn. We know it is experiential. It comes from an inner urge. And there's so many other factors. Like you cannot scold an adult. You cannot humiliate an adult. And that is what most of our medical students are. They are adults, and therefore their learning is also of this type. At least it was meant to be this type. Now here there is learning, exchange of ideas, knowledge, etc. between teacher and student, and also between student and student. And this is what the teacher says. I'll adjust how and what I teach so that it gives you the best chance for success. The tone of the teacher has changed. Earlier, the teacher was saying, I'll give you what I want, you take it or you leave it. Now the teacher is saying, I'll try to change myself according to your need. The teacher becomes a coordinator, coordinates, groups. A facilitator does not always tell everything, but helps. An advisor, a learner, very important. The teacher is also a learner and a guide. This, of course, again was society and industry driven. What was the need of the society? What was the need of the modern world? And that is how education changed. Things like flipped classrooms. I am sure all of you understand flipped classrooms, where the students first read, learn, and then they come to the classroom for a explanatory session. Group activities, etc., came in, and the use of technology became more purposive. It wasn't an invasion. Sometimes the teachers started allowing technology into the classroom. Learning was more individualized, not like the one size fits all, and experiential. And the approach was competency and also exam based. Both were there. It's a in between phase. And then moving on, and that is the present. And let's look at the future also, because we're going to harp a little on this. The 21st century. In the 21st century, it was more of homes and schools, colleges combined. Education became self-directed. Students decide, this is what I want to learn. And if they are asked to learn it, they ask, why? What is the need? There was more of problem solving, more of innovation, more of creativity. And into everything, technology is inbuilt. It's no longer like, okay, you can use it. It is part of education. And we are more concerned about now the hours of learning rather than the hours of teaching. Students have become connectors. They put things together. They create their environment and they construct ideas. And the whole purpose of education has become competency or outcome based. Little more of this, and this is what we call heutagogy, which basically means learning for self-directed learning. Heutagogy, there's no classical classroom. Yes, we have to have for certain purposes, for bodies which are the regulatory bodies, we have to have classrooms. But there's no classical classroom in the sense everything has to happen inside those brick walls is no longer true. And this is what the teacher says. Very interesting statement. I'll provide you with the resources and content you need so you can learn what you need in a way that works for you whenever and wherever you are. I will then make myself available to help you apply that learning in a useful manner. It's such a radical change of the mindset of the teacher from what it was before to now. The teacher is still a coordinator, a facilitator, an advisor, a learner, and a guide. All the learning is self-driven. The learning takes place at home. The skill development takes place in colleges or schools. I think we have experienced this well enough during these lockdown days when students are at home. They're learning. And the rule that MCI had set, I'm sure the NMC is also going to continue with it, that after coming back to college, they have to be given about a 2-month period to finish off the skills part. And only then their exams can be held. So this is precisely what it shows. Learning goes on from teacher to student, from student to student, the reverse also from student to teacher, and from people to technology to people. And that is what are the MOOCs. If we go online now, there are hundreds of MOOCs, whatever topic you want, you will get. MOOCs is a massive open online course. Online, open, meant for everybody. Some charge a few small amount of money, some don't charge at all. So these are available. The approach has become almost completely competency based. Now, up to here is fine. I think we have been delving in education 2.0 as medical teachers. We have been delving in education 2.0 quite often, although we are supposed to have moved on, but it's comfort to do that, just to talk and let it be. And we have been moving quite a bit towards 3.0, where we have been promoting group activities, we have been promoting self-directed learning, flipped classrooms have been conducted, all these sort of things we have been doing. So we are sort of between 2.0 and 3.0. And what happens in between? There comes the pandemic, and it's no longer the future. We are thrown right into the middle of it. The learning in this is supposed to be anywhere and from whoever. We are no longer that important. We are still there. We still have a role as teachers, but the learning can happen from whoever, and it can happen anywhere. It is self-directed. There is problem solving, there is innovation, and there's creativity. And many of the things, the learning resources, are AI powered, artificial intelligence powered. Take, for example, Khan Academy and some such things, where a student starts learning, starts practicing, and the system picks up that this is where the student requires more practice and gives them content accordingly. The content changes according to the student's need. There is research, there is innovation. Students are no longer knowledge receivers, they are knowledge creators. Any student can gather things and start off a wiki of their own, where everybody creates a wiki page. And of course, the drive is competency based. This is what we call education 4.0. The learning comes in contracts. The curriculum is flexible. Cafeteria method is used. I believe CBSE has tried, and even MCI has spoken about having electives. The cafeteria method basically is you're given a set of possible courses, and you choose from there, and you get credits from it. This is called choice-based credit system. Choice-based. You choose, this is what I want. The core area is the same. The elective area becomes a second part. Delivery of content is AI powered at times, as I said. The assessment can become flexible and negotiated. We are going to have exams this time, and this is when you're going to write, and whether you pass or fail doesn't matter. For example, again, it is the pandemic which has brought it out. I think it's been in the news recently. Haryana has decided to use this flexible method of assessment where even if a student fails, this is not about medical education, this is about other courses. At present, it is postgraduate courses. I believe it will go on to other courses, I mean, undergraduate courses also. Even if a student fails, they choose when next to write the exam. If they want to write it within a month, within 15 days, 2 months, they have to write to the university, arrange it, and they write. Instead of the next year or next 6 months, which is the next possible exam. So that's a flexible type, which is a part of education 4.0. And the job of the teacher is to create this environment, a dynamic learning environment. It is also the job of the teacher, as well as the students and all other stakeholders, to continuously train. We know that we want students to be lifelong learners. It is necessary that teachers also become lifelong learners. Doesn't it somewhat look like Gurukul, some of the features, but with a lot of difference? Of course, there's technology, and it is, many of the systems are little different, but We are going into a learning contract with the student. The student and the teacher are going into learning contract. I want to learn this, this, this. The teacher says, this is what you can do. This is how I will help you. So somewhat, to me, it probably looks like that. Okay. There are many teachers who found it very difficult to adapt when things started changing. This is one quote which I will be using again. If you are in the business of educating others, you need to understand the changes and evolve. This is what I've taken from somebody called Matt Church, who writes educational blogs. Let us do a little summarization of these four types. I will look at each of them as the need to learn, need to educate from the point of view of different stakeholders. What does the society say? In 1.0, society's need was religious. In 2.0, it was sort of government or the society itself mandated. In 3.0, the society sees it as an advantage. The more people learn, better things will happen. And in 4.0, this has become the need of the society. What about from the parents of the students? Parents of the students. In 1.0, the parents, and probably in 2.0 also, the parents simply wanted the student to be away. So that was a daycare, put them in a creche or something like that. In 2.0, the parents were looking at capabilities. The child builds up capabilities. And 3.0, I think all of us are aware of, that's what we are experiencing. The parent is looking at the competitive world. We hope in 4.0, the parents become more collaborative with the educational method and join in. From the point of view of the educators, in 1.0, it was imprinting your brain onto the student in a philosophical way. In 2.0, it was imposing. Learn this or else. In 3.0, it was inspiring. But in 4.0, the educators are inviting the students to come. You learn, you want help, I'm here. Now, I have taken up to this part, of course, I've created it myself from something which from a blog in the net, which did not include the students part. And I think I have to include the students part to make it more complete. In education 1.0, am I audible?
Yes, sir, you are audible, sir.
Okay, because my video suddenly vanished somewhere, so I was wondering. Okay, in education 1.0, the students had a desire to learn. In education 2.0, the students were forced to receive. In 3.0, they become self-directed learner. And in 4.0, they're looking for competence. But from the medical student point of view, what is most important? What do patients look for in us? In the ancient days, patients looked at wise doctors. In the Middle Ages, they looked at experienced doctors. In recent times, they look at degree and designation. But more and more and more, the patient is looking at somebody whom they can trust. And that is the important part which we need to remember. So that was the first part. Now moving on to the second part, and which is the competency-based medical education. I will just quickly take you through a few definitions which the MCI bar NMC has given. And we know that MCI describes competency as an observable ability of a health professional integrating multiple components such as knowledge, skills, values, and attitudes. Please note this word observable. Now, it goes on to say a lot of traits, 5 characteristics of the graduate. And that is going to be a clinician who understands and provides preventive, promotive, curative, palliative, and holistic care with compassion. A leader and a member of the healthcare team and system with capabilities to collect, analyze, synthesize, and communicate health data appropriately. A communicator with patients, families, colleagues, and community. A lifelong learner committed to continuous improvement of skills and knowledge. And a professional who is committed to excellence, is ethical, responsive, and accountable to patients, community, and profession. Of course, long descriptions, but what we should remember are these 5 words or phrases: a clinician, a leader and a member of the healthcare team, a communicator, a lifelong learner, and a professional. Now, having said that, the question comes: does CBME mean a different content and different skills to learn? Now, I will talk about this based on an experience. Last year, uh, the organizers of this event, Walters Kluwer, approached me to edit a book. This was the book, which, of course, this was the last year's edition. And I remember, I think for the past 4 years, our department here in Pondicherry had been recommending this book as one of the textbooks for the undergraduate students. Of course, that was the international edition, the first edition. And the reason we liked it is a few things which are continued in this the South Asian edition. But we did find a few things which were a little missing, because probably that book was meant for the US readers, and it did not necessarily comply with what we teach our students or what our regulatory bodies like the MCI or the NMC demand of our students. So there were some things missing. So I'll just quickly take you through a few things in this book. So this is the book which was brought out last year. And as you can see, it says here, as per competency based medical curriculum. I'll talk about that in a while. And the contents, I'm sorry, the images may be a little blurred because these are screenshots. Please bear with me. I hope you can make out the, sorry. The content, of course, all these standard chapters are there. The principles of physiologic function, which is cell physiology. The hematology part was missing in the international edition, because I guess that was not part of it. There was just a mention of erythrocytes along with respiratory system. So this is a part which we had to completely manufacture and put in. Nerve, muscle, gastrointestinal, cardiovascular, respiratory, renal, certain changes have been brought about here and there. The endocrine system has been reorganized. Most of the things were there, but the organization had to be redone. And reproductive system was again very sketchy, so we had to bring in. So was neurophysiology, little sketchy, we had to bring in. And the last part, the integrated physiology, was there, but we had to modify a few things. A few features of the book. This is what the first chapter of Unit 1 looks like. It's divided to 11 units, as you have seen. And every chapter starts off with a brief learning objectives. It starts off with the overview. Please note that the book is written not as notes, but as a textbook and in simple language. And every page, as far as possible, has text on one side and diagrams on one side. Then, there are tables wherever included, wherever necessary. Again, you see that there's text on one side and diagram on the other side. Then there is the clinical application boxes pertaining to all different things, which chapter wise, which are found to be useful for the first year undergraduate student. Then there are other snippets in little boxes which talk about uh, certain features which cannot be included under anything else, more or less clinical, but not application. And every chapter ends with the summary. And then, of course, there are a few other features. Like I'm just giving you one example here, but there are many very interesting figures, diagrams all over the text, all over the book. Some are sometimes a little hilarious also, but they do convey the meaning in a very simple way. And there are many photo plates which are included, which have come from the original book. And of course, there's another thing which is called the biologic sex and aging uh, box, where the of a disease and of a progress discussed, and how it affects in different sexes as well as with age. That is discussed. So that is about this book. And as I said, it is not in a notes pattern, so it's not really a bullet point type. It's a text, and there needs to be read as paragraphs, and you can extract information from it. Now, moving on, or rather moving back to competency-based medical education. When this book was being brought out, there were certain queries, and one of the query was this: is this book competency based? Now, I wanted to tell at that time that yes, this book is competency based. You can see it on the cover. All other books are also competency based, and the books which were brought out last year or the year before or even 10 years back were also competency based. And the books which are going to be brought out in the 5 years from now with different content, because science progresses, are also going to be competency based. Let me just give you an example. I don't know if there's any anatomist or biochemist here. Please pardon me. So this is what all of us, I mean, this is what threw us all into confusion. I mean, many teachers were really, that there are these 3 volumes that was brought out, and it was a lot to read, and people thought we have to learn again. We have to find out different methods of teaching. God knows what all we have to change, and it's going to be difficult. This, as we all know, is a liver. But this is a better liver. It functions better because this is a competent liver. This now has a tag AN, anatomy 47.5. So this has become a competent liver. Similarly, this used to be the Krebs cycle. Now this has become a colorful, beautiful Krebs cycle because it has a tag to it. And since most, I suppose, are physiologists out here, this was the Vickers diagram before, but I think that heart was failing. And now with this heart is running perfectly. The point that I want to make is competency has nothing to do with content. Content is something which comes with the progression of science, with the need of the society, but that is not competency. Competency is about learning that content and proving that it has been learned. Or if it comes to skills, learning how to do the skills, practicing the skills, and proving that you can do the skills. The onus is on students. If there are students here, I would like to stress this. The onus is on students. The responsibility is on students. One more question which comes up is, what about the delivery of the content? Does CBME mean teaching methods have to change? Can we still teach by taking lectures? No, yes, you can. You can teach by taking lectures, or you can teach by any other methods. But please do not forget this statement which I had made before. It is not competency-based medical education which demands that we change our method of teaching. It is the generation change, the whole educational system change, which is telling us our delivering a lecture and not finding out whether the student has learned or not is not going to work anymore. At every stage, we need to find out and help the student learn rather than teach. In fact, we know that famous statement that students will learn despite our teaching. So, frankly speaking, please don't quote it anywhere else. We don't even need to teach teachers. The students have to learn and have to prove that they have learned to you. So, what does CBME mean for students? It means that the student finds out what is expected of him. The student learns on his or her own or in collaboration with other students. The student requests the teacher to clarify and explain, and they listen. They don't just take notes. It's not that passive recipient. They listen. Listening means two ways. The student requests the teacher to demonstrate skills and they observe the skills carefully. This is the DOAP method: demonstration, observation, assistance, and then performance. The student requests the teacher to assist him or her to learn the skills, practice of skills, of solving problems based on the knowledge that you have, and then present yourself for testing. And by this, I do not mean the internal assessment tests or the final university exam. Present yourself for testing and then ask for feedback. Take the suggestions of your teacher, practice again, get tested again, get feedback again, and finally prove that you are ready to advance. That is competency. It's a cycle of find the objective, learn, prove that you have learned, get feedback, correct your mistakes, prove again that you have learned, and go on till the teacher can say, yes, you are competent. What does it mean for the teachers? It means getting into a learning contract with the students. The teacher has to tell the students, this is what I expect you to prove, show me at the end of this period. Guide the students about content. There are so many contents on the net, so many books. It is the teacher's job to guide the student as to which is reliable and which is not, and also to guide the student as to analyze content and figure out. That's where a higher order thinking comes up. Encourage the students to read on their own. The students will take a lecture, we want to listen, we want to write down notes, but it takes a little bit of effort to encourage the student to first read and then explain. Conduct explanatory lecturettes, small sessions. Organize. Now, this is something which the students by themselves may not be able to do. Organize group discussions, group activities, case-based or problem-based sessions for enhancing their learning. Demonstrate skills to the student. And this does not just mean procedures. It does not just mean taking the blood pressure or pulse. It also means attitudes. The way we conduct ourselves, the way we communicate with people, the students are watching and they are learning. So their learning has started even before we have opened the first chapter and started talking about the cell. At times, it is necessary to hold their hands, not in pandemic times, but in general, it is necessary to hold their hands, assist them, walk them through each and every skill that is they require to learn. Many students, especially if they are a little, slow in getting learning, they would want to stay away from us. So encourage them to appear in formative tests. Formative tests are not meant for scolding, and there is no question of marks being attached to their internal assessment. It is a pure learning process. It is called assessment for learning. Provide timely, constructive, and objective feedback and suggestions for improvement based on these formative tests. Follow the progress of the student. Finally, certify as ready to move on only if the students can prove themselves ready. And this continuous process of formative assessment, feedback, reassessment, it's quite a bit of a pain for the teacher, but that's the only way in CBME. Not what the content is, not what the skills are, and nor how we deliver them, but how we test, how we tell them this is right, this is not so right, and how we tell them to improve, and how to reassess. And of course, we have to be ready for change, to change our methods as per the needs of the individual student. Not every student is the same. Some people will take more time. I'll just give you one example. In our institute, we had started this system called uh, on-demand testing, which means it is on the demand of the student. We teach a skill. Let's say we teach them how to examine the cardiovascular system, and then we give them a little time to practice, and then we say on-demand testing is open. The ones who are confident, they come and get themselves tested straight away. The ones who are not so confident can take a little more time. Of course, the ultimate time limit is the university exam or a little before that. But they're open to come and get themselves tested anytime, depending on how you know easy it is for each individual student to grasp the concept or to master the skill. So methods have to change as per the needs of the student. There's one final thing. What is CBME for the patients? Because that is most important. And that is this. They have to be able to trust in a competent clinician. Somebody would, if I want to train somebody, I would want to train that person in such a way that I feel comfortable going to that person if I am not well. They want to find the person to be a team player and not somebody who, keeps blaming the other person. Oh, that doctor messed up. A communicator. We know the importance of this. Those who are close to clinical practice or those who are practicing would know very well how things are getting violent because of a lack of communication. Science is changing, and therefore a lifelong learner, not just the student, even us, and of course, an absolute professional attitude is what is required. That is what the patients will be looking for our students, and that is what we have to prepare our students to become. So thank you so much for your time. And if there are any questions, I think I'll stop sharing the screen now. If there are any questions, I will take.
Thank you, Dr. Das. Thank you so much for this session. I have few questions, to ask. So I just try to, although it's a little technical, but still I try my level best to bring it. So
Right.
one of the things is, just hold on, sir. The question is, sir, how we will apply it when discussing research methodology?
Research methodology.
Yes.
I'm actually a little, I didn't understand the
Yeah,
question.
actually, the question itself is a little tricky. That, sir, how we apply it when discussing research methodology is by Dr. Priyanka Chaudhary. Okay, so okay, let me just try to get it.
Yeah, we can.
Yeah. So one is how to about clinical skills. The question. Another question is about clinical skills. How
Right.
to attain authenticity.
Authenticity.
About clinical
Authenticity.
skills.
Yeah, if you're looking for authenticity, yes, I guess the problem is when there are videos available on the net, and I presume this is the question being asked. Something which we face, videos available on the net, and the student gets to see those videos and they practice with those videos. Now, whether they are practicing an authentic technique or not. Now, here, obviously, age-old standard books will have to come in, and we have to monitor what the student is doing. This is where teaching clinical skills over, an online method is definitely not done. Because I'm sorry, there's a bit of disturbance. I don't know from where. Online online teaching of skills, we can give them videos. We can, in fact, what we are doing right now is creating our own videos based on what is there in our records, which is based on standard textbooks, standard clinical examination textbooks, and uh, what we use, frankly speaking, are MacLeod's and Hutchison. And we have converted that, simplified that, made videos. But we still don't know whether the student has learnt or not. And that is the primary, that is the most important thing. We know that MCI has given us 2 months after they come back, and that's the time when we have to see. Over a video, the student may be hitting the shin or hitting it so hard that the shin gets fractured and saying this is how to do a knee jerk. Unless the student does in front of us and we guide them, the clinical skill part will probably not work out. I think there were a few.
Yeah, there were more questions, sir. It is like the one question I asked Dr. Jamuna. Is the CBME is time bound? Like each student has their own pace of learning. The
Yes.
exams and regular intervals should be there. So
See, we are living in a, if you don't mind the expression, in a khichdi world. I'm sure everybody understands the word khichdi, mixture of everything to create one, because ultimately everything goes into the stomach. CBME as such, any competency based education should have almost unlimited time. But unfortunately, I guess the country is in a hurry to produce, doctors, and it is also assumed that a person who's taking too much time is probably finding it difficult. So, yes, they should get enough time to do it, but at the same time, the university exams are held at a certain time, and there's a certain number of attempts, certain number of years which have been specified. Uh, uh, for achieving that stage, the phase. But within our own limits, we can always try to teach them and then allow them time to, sometimes what happens is we teach them a skill and we say exam is on this date, and that's it. After that date, there's no mention of the skill until the university exam. I know it takes a lot of effort, but we can continue that they can come and get themselves tested according to their own will anytime.
sir, another question from Dr. Supriya. I think it's
Yes.
almost the same question that she's asking. She's saying that how much emphasis do you think we should give on lectures in CBME?
Uh,
Like,
frankly speaking,
let me finish it first. How
yeah,
much emphasis do you think we should give on lectures on CBME? Can we
yes.
do away with most lectures?
Frankly speaking, we should have done away with most lectures long before CBME came, because that is what the progression of evolution of education tells us. But yes, I think the MCI has specified a certain amount of didactic. It does not say lectures. It says didactic. Now that didactic can be in different forms. So I think it is possible to completely change the scenario. Yes, it cannot be done for every student. There are some students who will not be able to learn unless we conduct a lecture. So this sort of flexibility is something which we have to work out in our individual institutions according to our individual need of the students.
Yes, a few more, sir. It is so. There's a Priyanka Chaudhary asking. He's saying she's from community medicine field, and there's a lot of confusion about how should we take few topics of statistics and research.
About,
Says a lot of confusion.
yes,
How should we take how should we take our few topics of statistics and research?
Okay. I mean, how should we take, if you're asking for the methodology,
I think yes.
the methodology can always be something like a case or problem based, uh, you have to create those typical problems and ask them to do. And of course, it has to be experiential because research can never be something you teach. Methodology you teach, after that, experience has to be there.
Okay, sir. So this is another interesting question. I can just tell you.
Yes.
Uh, just hold on, sir.
I think there are some questions being missed out because I can see.
Yes, sir. Actually,
Yeah,
yes.
it doesn't matter. I can take questions as long as uh,
Okay. So Dr. Mohammed is asking
yes,
that a mentor should be patient enough to demonstrate in front of students at least initially. Well, he is saying that initial guidance is necessary. The problem is
yes,
initial
yes,
guidance is very necessary, as
yes,
the mentor should be patient enough to demonstrate in front of students at least initially.
yes. No, that is if you're talking about skills, definitely. First, it is the teacher, the guide, who has to demonstrate the skill in front of the student. Now, there is a little thing. I hope this is about skills, because if you look at the MCI book, it says demonstration by the student. It cannot be so. It has to be demonstration by the teacher, which the student observes, and the teacher assists the students to do it, and finally the student performs. That is DOAP. I think there is some amount of confusion over there, but definitely it has to be demonstration by the teacher. We don't expect the student to, uh, just read something and do it.
That's a very typical question that is now being asked, sir. It's saying that students are asked for which book they should read. So the question is that how can you tell someone which book to read as there are so many books available? You know, being a publisher, I also want to know the answer of that because, like,
It is primarily, again, one has to look at the profile of your students. One has to look at what is the principle, what is the way the institution likes to teach. There may be a certain institution which would want to say, students, please, these are the questions, these are the answers, just learn this and pass. But that is not CBME. There may be an institution which would want to say, okay, we'll give you the detailed notes, read it, and write your tests and or skills. That is partially CBME. Or we would ask them, student, go read first, then come to us, explain. Now, depending on that, your book comes in. Of
okay, sir.
course, the teachers will have to research the books a bit before they decide on which book. We cannot say
Sure,
that this is the book and this is not the book or anything like that. There are many books which are good.
sure, sir. So another question is they're asking what is your opinion on teacher and student ratio? As you know, it is very difficult to bring out expected quality of students, which is dream of CBME, which present strength of teacher-student ratio.
See what MCI or an MC has suggested. I believe that's the minimum requirement. Now, I have I've been to institutions where they keep much more than the minimum required, and I've been to institutions where they actually have less than the minimum required, even government institutions. And during inspection from somewhere, people land up. So definitely, if what we want to do, see, ultimately, do we do our teaching and our administration based on what a regulatory body wants us to do, or do we do it looking at our students and their future patients, keeping that in mind? If it is their future patients, we want these people to be good, in which case the ratio naturally has to be much more than what is the minimum requirement.
Okay, sir, I'll just bring out the last question maybe that they're saying, can you please suggest methods to motivate slow learners, in a mixed population of students?
Yeah, see, their mentorship programs which are non-academic. Now, mentorship can be two types. You can have an academic mentorship, where you are actually guiding the student to learn and to perform. And then there is non-academic mentorship, where student is allotted to a person and they talk more on personal problems, family problems, uh, friendly terms. All this is done over a cup of coffee or even over a dinner or something. Uh, During those methods, the mentor can pick up if there are any specific problems that is causing the student to be undermotivated. See, one of the primary reason why students are undermotivated is they never wanted to come to medicine. It's their parents who wanted to come to medicine, and now this is the situation. But once they're in, they can always be shown different methods. We know of students who have gone through their MBBS course and then branched out something related to it. They've gone to the army. They've joined civil service. That happens. So the motivation, if that is the problem, then that can always be channeled. But finding that out, and that is where mentorship programs are essential.
It was not the last, but still one question is there. Is that how many case-based problems can be asked in one theory paper? Because in summative examination for the present MBBS first year.
I think they have what the MCI in the earlier documents had mentioned, that most of the MCQs will have to be case based, as well as uh, the long answer questions, which have to be a structured long answer. So how many? I don't think that is a specific number. I mean, it all depends on how. If the questions are formulated well, then it need not be a case based. But some of them, yes, because uh, exams do guide students' learning, and if there are case-based questions, then the students are more motivated to solve such problems, look at more cases, and look at it in a application manner.
So maybe the last circle, Dr. Mohammed is asking, can't higher authorities look over how clinical skills are being taught by the management?
By the management, I guess yes, higher authorities are supposed to look over that, definitely. But if we are talking about higher authorities, if you are talking about, if that means the MCI or an MC, uh, I think it will become extremely difficult for them to look over such things, and it has to come from within. If you mean higher authorities within your institution, then definitely yes, there is a curriculum committee every institution must have, which has to oversee all these things.
Okay, sir. So question is question from ADCOM is must in summative assessment?
That is what we have been asked.
Okay.
That is what we have been asked to do. It is a theoretical form of ATCOM. I don't think ATCOM can ever be judged with a theory question. But then that is what we have been asked to do, so we do it.
So great, sir. I think that's I believe there are a lot of but I think I've been able to translate the question that has been coming over and to you, and I'm sure that okay, you've been able to, you are definitely answer this question, questions to all the questions that have been asked by the people. And yes, just before the end, I would like to thank you for coming, taking your time out, and just
Welcome.
giving this fantastic lecture on behalf of Walters Kluwer, and also to all attendees that who have come and joined the session, Walters Kluwer. Yes, we definitely promise that we will come up, bring out some more sessions like this in the future. As and this pandemic time, this is the easiest and the best way medium to learn new things and to get such education from teachers. So thank you
I'm
so much.
sure all the teachers will be able to tell you
Yes, sir.
that they have attended more,
yes, sir.
they
In
have
fact,
attended
thanks.
more webinars.
Sure,
in the
sir. In
recent
fact,
months than ever
thanks to
before.
our faculties also that who have just come and joined this session. Thank you so much. Thank you so much, all.
Thank you. Most welcome.